We are all set now, Madam Chair.
Thank you, Madam Administrator. Good morning, everybody. Good morning. I want to welcome you to the Health Subcommittee meeting for appropriations. And I hope everybody is well. We didn't get any snow, at least down here, we didn't get any snow. So that's always a good thing right now. It's really funny how we change from really wanting snow and then say, no more snow. So I'm on the other side now of no more snow. It's really important. I'd say it's my co-chair. She's gone. So I'll ask Senator Minor, do you have anything you'd like to say this morning?
Good morning and good to be back. Thank you.
Thanks. All right. Let's see. Is Representative France around?
Yes, thank you, Madam Chair. Appreciate the opportunity. Looking forward to hearing from the agencies on their parts of the budget.
Thank you.
Everybody's here.
Thank you. Thank you. Let's see if we have any of the subcommittee chairs. Senator Abrams? No, I don't see.
She was on.
Yeah, Representative Dillon?
Oh, we haven't seen her.
Okay.
Senator Abrams is there, Tony.
She is.
She may be participating in other things, but she is.
Okay. All right. Well, Senator Abrams? No. All right, then we will get started with our first agency, Department of Public Health. Good morning, Commissioner Gifford. It's great to see you.
Thank you. Good morning, Representative Walker, and good morning to Senators Austin, Minor, Abrams, and Summers, and to Representatives France, Dillon, Kennedy, and to yourself, Madam Chair, and other members of the Appropriations Committee and Health Subcommittee. I'm Dr. Deidre Gifford. I'm the Acting Commissioner at the Department of Public Health and here to testify in support of the governor's budget. If I might, Madam Chair, I understand you want to just proceed directly to questions. I have a few agency leadership members with me. If I could just run through who they are, you know who's available.
Yes, I was going to ask you, that's one thing that we wanted because we want people to get to see each other and know each other because normally we'd be in a room. So it's important that everybody get to know who we're talking to. So I appreciate that. Thank you, Madam. Go right ahead.
All right. So we are joined this morning by Deputy Commissioner Heather Aaron from DPH, Adelita Orafici, who is our Chief of Staff. And if the team could turn on your cameras when I call your name so people can see you. Abdi Elmi from Fiscal Services and Chuma Amici from Fiscal Services at DPH. Tony Casagrande, our Chief Legal Counsel. Lori Matthew, Environmental Health and Drinking Water Branch Chief. Jafar Razak, who we've met, State Public Health Laboratory Director. Ellen Blashinsky, who is our Public Health Branch Chief. Dr. Matt Carter, State Epidemiologist and Infectious Disease Section Chief. Cheryl Sepulak, who is a new member of our team that came over from Department of Corrections, and she is leading our Joint Operations team, which has a lot of our COVID response focused work in it. And then we all know Bree Wolf, our legislative liaison.
Thank
Now,
you.
our understanding is that you wanted to defer agency testimony and proceed directly to questions. So I will turn it back.
Thank you, ma'am. First, I'm going to start out and I want to say to all our members, if you have questions, please raise your hand in the chat box so that I can recognize you. Otherwise, we'll continue. I have several questions, but I'm sure my colleagues have several. And what I've asked my colleagues to do is to ask two at a time so that we can give people a chance, because sometimes once we start talking about a subject matter, a lot of people want have continuing questions. So that will be helpful for all of us. So I'm going to open up first and ask, with the expectation of retirements, I see you have approximately 480 people in your personal services group. And I was wondering, do you have any people that you are expecting to retire in the next couple of years during the massive retirement that we are going to face here in Connecticut?
Undoubtedly, Representative, we will have a significant number of retirements. And as you know, OPM and DAS have been working with all of the agencies to plan for and put together a strategy for those retirements. DC Aaron, do you have specific numbers for the representative as to anticipated retirements?
Commissioner, we have approximate numbers at this time working with BCG, and the expectation that we are ranging anywhere from 35 to 100 individuals who may be up for retirement and can retire. But again, that is a move-in target based on many variables.
Thank you. Thank you, ma'am. Thank you for that answer. And also, the other question that we also ask is, did you, well, obviously you got money from COVID and CARES Act, federal dollars. Can you tell us approximately how much, or could you provide that to us in our subcommittee meeting later on?
Absolutely. And I think maybe both might be indicated, because you're correct that we have received significant federal dollars for public health response. If I might, I could just walk through them at a high level, which might be useful, and then we could defer the more detailed conversations for a subsequent meeting.
That would be awesome.
Okay, so we have received 3 significant types of funding. And the majority of these are what are called cooperative agreements from the Centers for Disease Control and Prevention. And a cooperative agreement is different from a grant in that it is more of a joint implementation of a set of defined activities, rather than here's some money and you take it in and do what you'd like with it. So these cooperative agreements come with a set of required deliverables and then some additional allowed activities. I'll run through them quickly. And then, as I said, I'm sure we can give you more detail in a future meeting. The first is the epidemiology and laboratory enhancement cooperative agreement. There have been 2. The first of those was for $182 million. That is runs through July of 2023. And it is aimed at the following activities: technology modernization, disease surveillance, operations of our pandemic response, communications, testing, and immunization and mass vaccination. As you all are very much aware, when this pandemic began, the requirements for the Department of Public Health to do reporting and disease surveillance of COVID were very intense. And we realized, as did the whole country, that many of the systems that we had for collecting and reporting data needed to be updated and upgraded. And so one of the main features of these cooperative agreements is to allow public health departments around the country to upgrade and update all of their technology and disease surveillance. It's also to modernize laboratory operations. So a significant part of this funding will go towards Dr. Razak and his team to ensure that they have the most modern capabilities and physical plant, as well as technology for collecting and reporting information in the laboratory system. So that's the first ELC, so-called ELC cooperative agreement. The second ELC cooperative agreement is more recent, and we have not
perhaps collect more.
We have not finalized the budget for that. And that is due to the Centers for Disease Control in mid-March. That was for $205 million and covers the same list of activities that I just went through with you all. There was one additional roughly $1 million ELC cooperative agreement focused on disease surveillance. And then we have received an additional $38 million towards our vaccination program. And we're using that for all the work that needs to be done around communications, outreach,
Thank you, Commissioner. And I expect that I've just opened up a lot of questions, so I will now go to Senator Minor. I know he's here. Senator Minor. Okay, he's probably shoveling his way to his camera. Okay. We'll go to Representative France, and hopefully we'll find Senator Minor in the next group of questions.
Great. Thank you, Madam Chair. Thank you, Commissioner, for coming here to talk about the budget. Two questions that are linked together. It seems like we're expanding the interest in drinking water in two ways. One is with the PFAS task force response, and then the second is focused, it appears, the budget with two new hires for school construction and others. So as from a policy perspective, setting aside the task force, you talk a little bit about that as well, but how prevalent PFAS is that we know in that area. But what gap was there identified in the school construction under existing levels of staffing that we need to add 2 positions really specifically to monitor that? And what were the indicators that caused that the indication this policy change needed to happen with additional staffing to support it?
Thank you, Representative. I'm going to ask Lori Matthew to give a detailed response, and I'll just introduce by saying that the department has been working closely with our colleagues at DEEP on implementing the recommendations of the PFAS task force. And many of the things reflected in the budget that you see are based on those recommendations, and the governor and my fellow commissioner are committed to making sure that we address the issues that have been raised around PFAS. But Lori, I'll turn to you for specific answers to the representative's question.
Thank you, Commissioner Gifford, and thank you, Representative France, for your question. And it's a good one. So regulation of public water systems in Connecticut, there's over 2,500. 170 of those are schools, 170. So a public water system serves 25 or more people, either community or non-community. These are considered non-community public water systems. So we have 170 of those that have to meet the Safe Drinking Water Act standards. Those don't get easier, they get more complicated every single year. So to meet those standards, our engineers, we have a group of about 45 engineers and analysts that go out and inspect the water systems. But as you can tell, with 2,500 public water systems statewide and 170 schools, what there needs to be is a focused effort to help our schools modernize their public water systems. With the new federal laws, whether it's going to be PFAS, us pushing that forward ourselves, or the new lead and copper rule, which is coming its way 5 years after Flint, that is going to put a new effort and a new focus on our public water systems that are schools. And again, those are in our more rural towns that have, a couple wells. They have a small tank, and they are, a small system, but it gets very complicated very quickly. When you have a school that has aged and there's aging pipes, there might be, problems and concerns in technology. And some of the schools, and working with our colleagues at DAS and OPM on the funding mechanism to rebuild a school, we also work directly with the architects at DAS to redo and upgrade the engineering of our public water systems. So this one person, and I understand that it's one, not two, it's one person that will be focused on exactly working with the architects at DAS, working with those school systems, working with SDE to make sure that our public water systems have a focused effort for them, that are schools.
Thank you for that answer. I guess in the 170 schools, some of those are on city water systems already, which I would presume are monitored that way. So are you more focused on the rural parts of our state, which may be well-based as independent water systems that maybe haven't had the oversight with the change in policies that you mentioned related to lead and others, that there's new expanded requirements that need to be monitored, and that the independent water systems, in the case of wells that are supplying our rural schools, that's really the focus of where this is? Is that accurate?
Yes, yes, and exactly. The 170 that are on their own, that are not connected to a larger system, to focus on those independent systems, because some of those have aged, some of those need to be upgraded. You know, there's consistent monitoring. There needs to be what we understand is a consistent focus and a consistent technology assistance, direct technical assistance to those schools, which we have found in many, whether it's in Hebron or others. You know, our engineers get directly involved with system upgrades.
Great, I appreciate that. If you could bring to the work session a list, 'cause I know there's been substantial investment in school construction. I know in my own town, there are two essentially brand new schools. So what number of schools are in that category of aging, needing of upgrade, and what that scope of that work was? If you could describe those 170 independent systems and which ones have been modernized through the school reconstruction program over the last several years, and which ones are of concern or more significant concern to DPH. Thank you. Thank you, Madam Chair.
Thank you. Next, we have Senator Minor, who has returned. Senator Minor.
Thank you, Madam Chairman. I'm trying to juggle constituent phone calls and hearings. Normally, you'd be able to step out of the committee room and do what no one can see us doing, I guess, at this point, which is trying to do the other day-to-day stuff. So
Yep.
Thank you. I'd like to stay on that subject of PFAS and testing, because in the Environment Committee, we have two PFAS bills. I'm not aware that the Public Health Committee actually took up a PFAS bill this year. And so my question is with regard to very small rural community wells. Are there currently standards, and is this person intended to kind of oversee that program as well, in terms of making sure that the right equipment is in place and we're doing the right testing?
Go ahead, Lori.
Thank you, Commissioner, and thank you, Senator Meyer, for your question. It's an important one. So this one position will be part of a team. We're also in the budget have additional staff to focus on PFAS, to help us with staff at the lab to get the equipment in place in the laboratory, to have a toxicologist focused on PFAS, to have a lab consultant focused on PFAS. This staff person, who will be an engineer, will be focused on helping with the technical assistance for everything from start to finish, water quality, including PFAS, including understand the risks. But they'll be part of the team when the new team of the group that will focus on PFAS specifically. They'll have we have a very solid plan under Governor Lamont and the task force. We have a solid team right now. We need to add to it. We need to continue to develop standards. You had a good question about the standards. We have an action level in the state of Connecticut right now. We believe through our PFAS action plan that we need to move on to setting a state MCL, maximum contaminant level, because the federal government has slowed the whole process down. Good news, just yesterday, the Biden administration announced a renewal of at least 2 of the thousands of PFAS chemicals. So they're moving in the right direction, but it's going to take time. So the person that we will hire as an engineer will be overseeing all technical aspects of those 770 schools: water quality, water quantity, engineering, and will have the technical expertise, including PFAS, including understanding the risks to water quality.
And so maybe I missed the timing in your conversation with Representative France. Is the timing of this proposal in the first year of the biennium? Are you anticipating having all the appropriate testing equipment in place so that once this goes live, each and every community water system will be tested?
Yeah, actually, one of the bills in the Public Health Committee, I forget the number, is to require the Department of Public Health to come up with a testing plan. That's actually one thing we are developing right now. There's over 12 PFAS bills, whether it's in environment or public health, and there's a lot of interest in it. So we are moving forward with equipment purchase for the lab. And along with the staffing, we believe by the end of this calendar year, we will be able to hit the ground running. And that's your sense of timing, that we hope to have the equipment in place. We hope to have the staff in place, and we hope to be able to have our plan for testing, which would include schools. And this person, so it's a very good question, Senator. This person, this engineer, will be the technical expert to help with our team of PFAS experts to be able to help schools directly with PFAS sampling, because that's the effort. We want to help schools, we want to help municipalities and our water systems that are smaller, that struggle with the technology and the funding. For testing drinking water for PFAS, because it's expensive, it's complicated, and it's complicated technology.
I do have some other questions, but I think we're on the 2-question rule, so I'll wait and come back. Thank you.
Thank you, Senator. Senator Austin?
Thank you very much, Madam Chair. I'd like to go back to Senator Minor's questions to Lori, and thank you, Lori, for being here today. I know if I have a question vis-a-vis water, it is something that we can really get to. So I'm curious, in some of the larger communities that have multiple school systems, who is testing the water in those multiple school systems? I know they test the water, but do they test it by building? So for example, in Norwich, Kelly Junior High and Veterans Memorial, 2 different schools, do we test for lead and other chemicals by the building itself? Or is the building itself or the school system required to do that testing?
Senator Austin, thank you for the question. It's a good one. The federal law that we are under currently, there's no requirement to target a school within, say, Norwich. If you're certain Norwich water system, 35,000 people, 6 or 7 schools, they do not have to go to the school and test specifically for lead. The new federal law, which has been announced and is being pushed by the Biden-Harris administration, will do that.
Okay.
That's the good news about that law, and that's why we don't want it slowed down. Right now, it's on pause. And we hope that in the next 3 months, it will move forward. There are some efforts to slow it down nationally. We don't want it slowed down. We want this to move forward because it will target schools, daycares, and it will require water systems like Norwich to test and sample at those schools and daycares.
So thank you for that. And I only use Norwich as an example because I know the names of those schools there. So I'm also as concerned in any of the urban areas. Regarding small water systems, again, I'm going to use a town in my district, Hebron, which had a huge problem with water capacity. Are any of the current laws looking at water capacity in some of these areas? So we're looking at trying to expand affordable housing and making sure we're dealing with different issues. But one of the issues in some smaller rural communities is the lack of capacity for water. And I know sewer is DEEP, but I'm curious, are we dealing with the issue of capacity in water systems to provide the necessary water in these smaller towns to build these different affordable housing components?
So, Senator, great question. So there's a state law since the 1980 known as the Water Supply Planning Law under our Title 2532D. In Hebron specifically, because it's owned by Connecticut Water Company, they are required to produce that plan. So they worked with the town in Hebron, specifically the town planner, to look at supply and demand. But before they were owned by Connecticut Water, they didn't really look and dive deep. The problem you have in certain areas, in rural areas, you make the assumption that there's plenty of water there and you can just drill a hole in the ground. Well, in the case of Hebron, they spent over $1 million looking for just 20 gallons a minute. They could not find it. So that is an issue, you know, the assumption that's made, if you drill a well in the ground, you're going to find sufficient water, and that's not always the case. So planning is necessary. We have individual water supply plans for our larger systems that own the smaller ones, they're included. And I can give you some lists to show which ones are covered under these water supply plans. And as some of you may know, we also have a regional planning effort. We bring all the people together from the 3 regions of the state under our WUC process, the Water Utility Coordinating Committee process. We bring towns, environmentalists, water systems. We could invite all of you to those planning efforts. We just kicked off the implementation of those regional plans, working with the Council of Governments. So there's a number of layered planning components, because you're right, you can't just drill a well and assume that there's water going to be there. And that is something we have to be mindful of when a developer, you know, plans for something and there's sewer there, but they want to put a couple wells in the back, and that used to be a cornfield. You know, you got to be careful and mindful about quality and quantity, and it's a complicated engineering analysis that goes on, and my engineers get involved with that. That's one of our jobs.
So I want to thank you. I also want to thank you personally for working with the redundancy effort of the water system in a town that at one point in Sprague, we only had 10 days worth of water left. We now have the capacity, because of your work and the Department of Public Health's work, to plan for redundancy efforts. And I think that that's one of the singularly best things that happened during my administration in Sprague, was to make sure that they would never have to deal with that only 10 days left of water for 3,000 people. Thank you very much. Thank you, Madam Chair.
Thank you, Senator.
Thank you. Senator Abrams? No. Okay. Representative Dillon.
Good morning, and thank you. My system is patched together between the phone and the laptop because I lost audio. So if you can't hear me, just signal. That's why I'm identified twice. Thank you very much for your testimony, Commissioner. There will be a lot of questions on some details. This is obviously, you're involved in an area that's really critical, and I want to thank you for the efforts that you and the governor's administration has made. There are a number of questions that I assume that we'll be able to unpack later about how some of the issues involving this vaccine distribution will be rolled out, because obviously there were a lot of questions late yesterday. But I do specifically want to ask if you could provide to the work group any resources dedicated, preferably through CARES Act or COVID dollars, but maybe not, to our community health centers for screening for people who might be HIV positive or immune compromised in other ways that would put them at higher risk in a COVID epidemic. And the second would be any technical assistance and resources that you've provided, particularly to DDS, for people who have IDD or Down syndrome who have a higher case fatality rate from this. I understand that they've been kind of moved down on the priority list, and it would be helpful to understand what support you're providing to the departments and to the providers on how to protect the people who are going to be deferred for another month. So I don't know if that's one question, Madam Chair, or two. It's directing dollars to vulnerable populations. On the second, I guess I would file on the water quality. Being a veteran of earlier water discussions between the big cities and the well owners. On the really important work that your department does on what we used to call potable water, what is exactly is your relationship with, let's say, South and Central Regional Water Authority and or the Hartford-based system? And then there are a number of smaller groups in Norwalk as well. Are the ratepayers handling that? Do you provide technical assistance?
Thank you, Representative. I'll take the first two of your questions and then turn to Lori for the response on the water quality issue. With respect to our community health centers, we have been working very closely with them, and they have been extremely valuable partners for the state throughout the pandemic. We've been working with them in two ways. First of all, on our testing program, many of the health centers chose to become what we call testing partners, meaning that they were not only testing individuals within their four walls and their own patients, but assisting us in doing pop-up testing and focusing on making sure we had adequate testing resources in our high-risk cities and towns. The FQHCs also receive large amounts of direct funding from the Federal Health Resources and Services Administration. And with all of the stimulus funds that have been passed to date and again planned in the one that's being debated right now in Congress, there are large appropriations that bypass the state and go directly from HRSA to the FQHCs. We're working with them now on our vaccination rollout program, and it's been, again, a terrific partnership. They are not only, again, vaccinating their patients within their four walls, but also doing outreach, really significant outreach in the community. Again, the federal government has decided, and it was announced last week, that they would be sending some vaccine allocation directly to FQHCs, bypassing the state's allocation, and it would be on top of the allocation that the state gets. So extremely valuable partners. We've been working closely, I would say, on a daily basis with their leadership and their members, and we value their partnership. The governor announced yesterday that in this next phase of vaccine rollout, we would be setting at DPH numerical targets for each of our vaccine providers to reach on vaccinating people within the highest risk cities and towns. So not only are we sending doses to those cities and towns, we will be asking our providers to make sure that they are administering those doses to people who live in those cities and towns and not to people outside of them. So there'll be more information on that numerical target later this week. With respect to DDS, again, the department and in particular our infectious disease branch under Dr. Carter's leadership have been working extremely closely with DDS from the beginning on everything from testing to visitation to management of some of the very complex questions that they've had to face at their residential facilities, their day programs, et cetera. I've been working with Commissioner Sheff as recently as about 5 minutes before this hearing started to talk about vaccine administration and how that will roll out. And a member of their staff, Katie Rock-Burns, is working very closely with us on identifying vaccination partners for individuals who live in congregate facilities and making sure that they're vaccinated. So we have a very close working relationship and have been providing extensive technical assistance and support to DDS throughout the pandemic. Lori, do you want to answer the question about the drinking water quality and the relationship to the water?
Before we leave that, Commissioner, if you could provide the work group with the information I requested on any stepped up testing of people for HIV so that they would be screened and we could identify. And I see that there is a cut also to the LGBTQ center in as well, but the specific of the dollars and whether or not there's heightened screening. Thank you.
Will do.
Representative Dillon, Mrs. Lori Matthew. I hope I answer your question correctly. So I understood it that you asked about the relationship that we have with the Regional Water Authority that serves Greater New Haven, the MDC that serves Greater Hartford. Norwalk has 2 large public water systems serving over 40,000 people. We regulate them as public water systems. They are regulated public water systems under the Safe Drinking Water Act, which we've encompassed within the state law since the 70s. So we, as regulators, we oversee quality and quantity. We work closely with them, however, when it comes to disasters, even with COVID, we are holding every other week, we're holding webinars to talk to them about keeping their staff safe while they're out in the field, running the treatment systems and running the water systems that supply all of our hospitals and nursing homes. We have met consistently with them to make sure we understood through COVID what is coming and going, because we can't have them fail, and they understand that. So one of the things that we do, as regulators, we also inspect their water systems. We get out there every 3 years and we issue engineering technical inspections of the pumps, the motors, the treatment systems. And we also review and approve anything new that comes along. If you're proposing new treatment, we have to, under our state laws, under the Department of Public Health laws, have to review and approve those. So we have a close relationship. We work well together, but we regulate them. So one thing that we have been doing is making sure we know what their needs have been through COVID. And through, if you remember, we went through a drought this summer, and then we went through the tropical storm in August. So, we had all of those efforts, and, where we need to work together on storm response, whether it's storm response, cyber, the recent cyber issues that we've heard of in Florida, the issues we're having in Texas with water systems in Texas, we work closely with them, but we also regulate them. So there's that fine line.
The questions the really helpful questions that were raised by the senators about PFAS. Should I conclude then that when it comes to the larger water systems in the cities, the ratepayers are pretty much in charge of that? Or is your department providing any assistance on that?
Financial assistance?
Right, or technical?
Well, we provide the technical assistance. We're also looking to help with our SRF program, the Drinking Water State Revolving Loan Fund. We have stood up some additional assistance there through a state subsidized loan program to help water systems deal with treatment systems. Right now, there is a proposal in one of the cities that you mentioned for a treatment system, multi-million-dollar treatment system to not only treat for PFAS, but to treat for manganese and some other contaminants. So we have stood up a program to help subsidize the federally based leveraged state revolving loan fund that we do have right now. It's going to take, once we get started, now the larger systems have tested for PFAS, and that information, as we get our staff in place, we will start to get that information out the door. The good news is they're not finding it in the numbers that we found in other states. That's the good news so far. When we start testing more broadly, I think we're going to find it.
Thank you. Representative Dillon, we're supposed to limit to 2 questions, and then if you have a pile on, we'll get them towards the end. But I did ask everybody to do 2 at a time. Next, I want to see if Senator Abrams had any questions. There you go.
Thank you very much, Representative Walker. I appreciate that. As all of us are, I'm trying to juggle many things at once here. So appreciate you coming back to me.
Okay.
I think my one of the concerns that I've had all along, and luckily as the chair of public health, I have the opportunity to have many discussions around these things. So I always appreciate that. But in terms of the budget, I've been very interested in how we can support our local departments of public health. I know, Commissioner, how much we relied on them throughout this pandemic. And I know also that the good work that they do even outside of that with things like lead testing and education and information when it comes to tobacco or vaping and all of those important issues to the public health of our communities. So I'm wondering where in the budget you've considered that. I also am very interested in health equity and how we can address health equity in terms of the budget in public health. So if you could speak to both of those, I would appreciate it.
Thank you, Senator. With respect to local health departments, they have been critical and essential partners with us on the pandemic response. We have appropriated, we've allocated and budgeted $20 million for local health departments from ELC, the first ELC grant, ELC cooperative agreement that I described. So the first segment of that funding has already been released to public health departments, local health departments, and they have been using that for a variety of purposes during the COVID response. It's gone to personnel, it's gone to overtime, it's gone to IT and website development to help them with their telephone answering, et cetera. So there was also early on in the pandemic, before or just after my arrival at DPH, there was an additional $2.5 million of a crisis response grant that went directly to local health departments. So there was that 2.5 that helped with their sort of readiness. Then the 20 million that we've budgeted out of our first ELC grant, which was used to support a significant proportion of their contact tracing efforts. Many local health departments, as you know, did a lot of their own contact tracing. Some chose not to, and that was done by the statewide pool. Also supported their enforcement activities. So they've been out, enforcing the sector rules and making sure restaurants and other public venues were not overcrowded. In addition, we have the next ELC cooperative agreement that I mentioned that we're developing the budget for now. We anticipate there will be additional very significant funds in that for local health. So far, $22.5 million and more to come for local health. With respect to health equity, we have, and I will ask Deputy Commissioner Aaron to speak to this. We have in the department, as part of our overall strategic planning and our accreditation, a division that's focused on making sure that equity is a part of all of our programs. And that is a standing, existing part of our staffing structure and our strategic plan at DPH. With respect to the COVID response, we have been focused on making sure that our measurement is doing the best job that we can to measure both cases and deaths by race and ethnicity so that we can understand the disparate impact of COVID on communities of color. And we've also been focused on making sure that the resources were allocated appropriately to higher risk communities. So that was the entire emphasis behind our community testing program, which was designed to make sure that free testing was available in our highest risk communities. And that's how, we've spent the last 7 or 8 months under the leadership of the Chief Operating Officer's office, making sure that we had partnerships with our highest risk cities and towns to stand up testing. And then I just mentioned, Senator, the efforts we're making on our vaccine distribution, both to measure and make sure that we are appropriately administering vaccine, not just allocating doses, but administering vaccine to people who live in these highest risk communities. And we'll be setting up specific strategies with all of our largest vaccination partners to make sure that they are reducing barriers to making appointments, reducing barriers to accessing the clinics with issues around transportation, and make sure we're addressing hesitancy to the extent that it exists in those communities. DC Aaron, do you want to add anything? DC Aaron is leading our development of our plan on the vaccine rollout for health equity.
Good morning, everyone. Commissioner, I see that you did a very comprehensive job in responding to our equity question. We everyone knows with our federal grants in each one of our programs that we do, there is always the equity question, and we do that with breast cancer, with everything that we do. Specifically now that we're facing the COVID pandemic and working with the equity issue, which is affecting everyone across the country, we are developing a very strategic grassroots program to work on equity in our communities. We are beginning our grassroots education with different community leaders, religious leaders. We have individuals who work with us who are on our contact traces, who are bilingual, who are our community outreach specialists that are listening to the folks on the ground, listening to the people they're talking to, and we're developing responses related to that. What we're hearing is that there is a strong sense in the religious community that there may be issues with this vaccine, so we have to educate in that area. We are also going to be focused in with our local health departments to give them the ability to have people come locally as opposed to having to reach out to the hospitals. If there is someone in that community that is bilingual, we want to reach them with their language. If there's someone in that community that needs to be educated at their doorstep, we're going to go to the people as opposed to having the people come to us. So we're looking at the allocation to focus in on these areas and working with the hospitals, the FQHCs, working with our folks on the ground and the community. So we will also be reaching out to the legislative body to get as much input as possible so that we can move forward. Thank you.
Thank you very much, Commissioner and Deputy Commissioner Aaron. I really appreciate your response. I appreciate all the work that has been done throughout this pandemic. And, I know firsthand how you have done exactly as you're speaking of, that you've really taken health equity into consideration throughout your approach to everything as we've gone through it. And but when I look in terms of this budget, I'm trying to think hopefully beyond the pandemic. I'm hoping that there is a world that exists beyond what we're experiencing now. And so I'm also hoping that all the lessons that we've learned, all the things that we've seen throughout this pandemic, such as the incredible inequity there is in healthcare sometimes, such as the incredible efforts of our local departments of public health and the incredible role that they serve, that we keep that in mind as lessons to have been learned. And as we look at the budget, we reflect that in how we're spending the money that we have. So I thank you for all the work you've done through the pandemic, and I ask that you continue looking through those lenses long term, and that this just isn't a pandemic response. And I feel confident that you will. So and if you're not, I feel confident that there are those of us in the legislature that will continue to remind you that that's very important to us. So thank you so much.
Thank you.
Senator. We look forward to working with you.
Thank you, Senator Abrams. Commissioner, could you provide for the working group the breakdown on the local health centers that of the 22.5 million and how it's dispersed, so that we can see and we can share with some of the colleagues that live in those towns, and the dollars that were dispersed to the FQHCs also. Thank you. Let's see, Representative Datham.
Thank you very much, Madam Chair. And thank you, Commissioner. I know you coming in as acting commissioner in the middle of a pandemic wasn't what you signed up for, but so thank you for your efforts. And really, it is appreciated. I have two questions, and you're welcome to bring them to the working group because I want all my colleagues to be able to ask their questions. I'm asking every agency that has headcount going out as part of the consolidation of human resources to have a good explanation on how they envision that this is going to help their agency and make their kind of internal HR function better. Just want to make sure that you guys are all on board with that. That's my first question. My second question really has to do with the adjust the funding for the LGBTQ Health and Human Services Network. This is something I fought for in Human Services, which is one of my other committees. We have a local organization, TCC, here in Norwalk that does amazing efforts. We're very excited about this initiative. And I understand that you've only spent 25,000 so far, and you're looking to permanently reduce this. I don't think this is the time to be making cuts to this program. This is a very needed program that addresses our youth and people who are in this community. And really, I think this is an investment in that community, and I'm a little concerned about a permanent cut. So if you could please explain that, that would be great. And if you want to do that in our working group, that's totally fine, because I want my colleagues to ask their questions as well. So thank you so much, Commissioner.
You're welcome. And we will take you up on that offer. I think it might be useful for us to bring the exact spending on the network so that you can see how we arrived at that, the budget number. So we'll do that. Thank you.
Thank you. Thank you, Madam Chair.
Representative McCarty.
Yes, thank you, Madam Chair, and welcome, Commissioner, and thank you for submitting your testimony today. I have two quick questions. The first, and I'm very pleased to see that in your testimony, you mentioned opiates, because during the pandemic, as we know, we've had quite a significant increase. And I was interested in asking you a little more about the new opiate test and the surveillance efforts, looking at the clinical section of the lab. Could you just comment on that for a moment? And then I'll go to my second question.
Yep, I'm going to turn to my team members for your response, Representative. So I don't know if that's you, Dr. Rizek, or Dr. Carter, if we need to bring that response back. Is there anyone that can speak to the new opiate test that's in the budget?
I can, Commissioner, thank you. This is Jafar from the State Lab. I can comment, and if Matt has anything else to say. The State Lab, can you hear me?
Yes. Yes, we can hear you, Jafar.
Yes.
Okay, good, great. So the State Lab, late 2019, before COVID-19, COVID hit us, we aggressively went and validated testing methodology to look for these different opioids in patient clinical samples, blood and urine. And there are two ways to do testing. One for surveillance purposes, which requires minimal validation processes. And the other way of doing testing is through more certified and clear-based testing approach, which requires a very vigorous validation process. And we chose the second approach so that we are able, at the end of the day, to be able to test patient specimens and issue a report back to the healthcare provider to act on this report. Because for the surveillance purposes, we cannot issue a report for patient management. So that's what we did. And we went live beginning of January 20, offering the testing for hospital labs and for hospitals around the state and who needs this service to be able to do it. Unfortunately, COVID-19 came in and did a lot of interruptions for emergency rooms and others. So this data, hopefully when we are back to normal, will be not only going back to reporting to healthcare providers, but to our DPH program to look for, where are the pockets of these opioids are spreading around the state for targeted education. Thank you.
Thank you.
Thank you. Thank you, and I very much appreciate that response. I think it's important work and has to be continued, so thank you. My second is an approach question, Commissioner. Under the other expenses account, if you would please, for the breakout and for the sub work, if we could have more detailed on what those other expenses are in the account. I noticed you did put some of the areas that those fundings will be used, but it's a 7.7 million each year. So if you could please break that out for the sub work group, I would appreciate it. Thank you.
Thank you. Thank you, Madam. Representative Abercrombie.
Thank you, Madam Chair. Good morning or afternoon. Yeah, still morning. Good morning, Commissioner. Thank you to you and your team for being here. And I do want to agree with my colleague, Senator Abrams, about the outstanding job that DPH has done through this pandemic in these really difficult times. So I do want you to know that we do appreciate that. But having said that, I need to ask a few questions of areas that I have concerns. One of the areas, and I'm not sure if you're working with SDE on this issue, but our school-based health clinics, right? What are we doing about screening for mental health with our young people? We are hearing more and more, and I think the evidence is out there about suicide being up, trends being up, kids just going into this really black hole of depression. And as more and more schools are going to be opening, we really need to have a plan as to how we're going to address this. And, you know, in your budget, I don't see anything in a write-up around the school-based health clinics and how we're going to maybe perhaps take some of the CARE Act dollars, and we could do it through a grant process to be able to add some staff to be able to do some screening. I'm really, really concerned about what's going to happen when all of these schools open, because we know there are areas in the state that have been closed for almost a year. I can't imagine what these kids' mental health is going to be like by the time they get in school. So I'd like to understand that a little bit more. I'm also kind of surprised that there isn't anything around nursing homes in here. You know, we've had 2 reports out there. One was Mathematica report was the first one. And then the second one was the work group that was put together. I know that there are different bills out there, but I'm actually surprised that there is no policy decisions or even some financial dollars in here. I know a lot has been done through COVID, and maybe we need to have a separate document on COVID dollars alone to understand how we've been supporting our nursing homes at this point. So if you could talk a little bit about those 2 areas, I would be grateful.
But Representative Abercrombie, can I get you to, we're at the final hour, so can you get that information for the subgroup? Is that okay?
Absolutely. I'll send it to Sue Keene, who can send it over to the agency to have it ready for the subgroup.
Absolutely. And to also make sure that we are addressing, we'd like to know what dollars were sent to the nursing homes and what were the specifications for those dollars that were sent there. I was going to ask that towards the end, but I agree with Representative Abercrombie. I mean, even with Mathematica's reports and everything, there were a lot of recommendations that they made that are going to cost money, and I don't see anything in the budget to address that infectious disease control and how we're going to address that need, and staffing and a few other things. And looking at the workforce retention that's needed for our nursing homes, I think that is something that has to be talked about too. So we look forward to it, and I thank you, Representative Abercrombie, for bringing that up.
Thank you, Madam Chair.
I see Representative Gilchrist has a question, but it's going to have to be taken off because, I mean, not taken off. Whatever the question is, it'll have to be answered in the subcommittee. And I think 2 other people want to go back for a second go round. So I just need the questions so that we can have them. Representative France and Senator Minor, I think, said he's going to probably just send the questions to Susan Keene. So Representative Gilchrist?
Thank you, Madam Chair. Yes, I'll be quick. I was just hoping to have some background information on the tobacco and health task force line item that used to be in existence and I believe was eliminated as we're having conversations about banning flavored vaping and potentially menthol combustible cigarettes. I think we should be investing in cessation and prevention. And so I'd love to know more about the history there. Thank you.
Thank you, ma'am. And I think that's a good idea. Somebody else had sent me an email about that, asking for the breakdown. I think it's 110 million that we get. And it right now it goes right into the general fund, but it would be good to see if there's some things that we need to direct those to.
OFA can, just to jump in, OFA can help out with that too, because that money is really a revenue stream, and a small amount was proportioned off for the Tobacco and Health Trust Fund, and that was eliminated quite a few fiscal years ago. So we can provide that to you, but that revenue stream goes directly into the general fund. That 100 million you see, it's not DPH's.
Okay.
It wasn't ever. They're separate, the Tobacco and Health Trust Fund and the Tobacco Settlement Fund.
Okay, thank you. Representative France, you had some questions to bring to the committee?
Yes, and these responses can be to the work group is fine. Looking at the budget line item for the local and district departments of health, I noticed that it's flat funded from FY20 through on. Is this first part does this include the reductions from 2019, the 10% reduction? And the second piece of it, given their greater involvement, particularly in the pandemic response, it would seem to me that there would be a need to increase the funding if we're increasing the scope of what we expect our local health districts to do in supporting their towns. And so trying to understand what DPH's plan is for that and where that funding is going. So if you could bring that to the work group, that'd be great. Thank you.
Thank you. Let's see, somebody else, Representative Dillon, are you going to give us your questions, or are you going to send them to the Madam Administrator?
Madam Chair, I'm sending some to the administrator, and I believe some of them are just a restatement or clarification of earlier questions. Thank you very much.
Okay, thank you. Senator Austin, did you have some questions, or are you going to send them to Madam Administrator?
I would send them to Madam Administrator, and I'm on the regs review with Senator Minor, and I'll remind him to send his questions in also.
Thank you, Senator Austin. Thank you, everybody, and thank you, Commissioner Gifford. I will just say that I was a little concerned, and at first I want to say thank you for what you do. And I know your family probably says, "Who are you?" nowadays, because you don't get a lot of family time, and I appreciate it because you are working all 7 days. But I was a little concerned. I'm concerned about the elimination of the regulations that we were using in handing out our vaccines. I'm very concerned about our communities that need the most effort and work. And I know that's something that we mentioned with Commissioner Jabal yesterday. And I think there are a lot of people have been contacting and concerned about it. I understand the complexities of trying to figure out who gets the vaccine and who is on the preferred list versus and I'm glad to hear a lot of the conversations we had. Sorry, my dog. A lot of the conversations we had, Kobe, shush. A lot of the conversations we had are about community centers and community health centers and churches. Those, especially for minority communities, are critical. That's where they get their health care, and that's where they worship. And those are places that I think we need to focus on, and especially for the Black and Latino communities. And the fact that we didn't have sickle cell or spinal bifida as on the watch list for early vaccines, I was kind of, I was a little upset because we know those are diseases that hit the minority community more than anything. So I hope we can have a understanding on how we chose to go to age. And I know Massachusetts is doing that. They just started they're planning to do it too. But I hope states don't do that until we get a better handle on vaccines for our minority communities, because they are frontline workers also.
Agreed, Representative, and we want to do everything we can to address the concerns that we're hearing. We understand them and welcome the opportunity to have further conversations. We have scheduled a vaccine briefing for the entire legislature, and at least I think it's scheduled. We've been working on it for this Friday. So we'll have an opportunity to entertain further questions there, but I'd be happy to speak offline to discuss this more if that works for you.
And whatever we schedule for Friday, could you please look at our appropriation schedule so that it don't conflict?
I know Bree.
Everybody will be there.
I know Bree is working with the teams at the legislature to pick the right hour. As you alluded to, unless we did it, between midnight and 1 a.m. on a Sunday morning, we probably wouldn't find a time that works for everybody, but we're doing our best.
We are. So thank you, ma'am. And thank you to your whole staff and everybody here. Thank you.
Nice to talk to you all.
Okay, have a good day. Okay, so we're in the midst of exchange. We're going now to Department of Developmental
alluded to,
Department of Developmental Services, Madam Administrator.
Yes, ma'am. The commissioner and his team have been admitted.
Awesome, 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 awesome. I'll do this, okay. Do I see Commissioner Shep?
He's there.
Oh, there he is. Okay. Wow. That beard is getting long.
I hope my wife isn't watching when you say that.
Sorry. Good morning, Commissioner. It's good to see you.
Good morning. Good to see all of you as well. And thank you for the opportunity to be here this morning. We've submitted our written testimony on behalf of the department. My understanding is you'd like to move right into questions. I will ask my staff on the call today to unmute themselves and introduce them. It'll put a face with the name because they have really been working tirelessly on our COVID front, but across all efforts. So if they would, Peter, if you'd go first and then pass that around, I'd appreciate it. Deputy Commissioner Mason.
Hi, I'm Deputy Commissioner Mason. Glad to be here.
Katie.
Good morning, Katie Rockburns, Chief of Staff.
Krista.
Hey, Krista.
Good morning, everyone. Krista Ostaszewski.
Scott McWilliams, my CFO.
Hi, I'm Scott McWilliams. Good morning.
Thank you, Scott. And I believe Rod O'Connor is also on with us today.
Maybe.
You all know Rod either way.
Oh yeah, we all do. So thank you, sir, and thank you for being with us today. What we usually do is we ask everybody to do 2 questions at a go round, and we start with the chairs and then we work our way through the membership. And if people still have questions and we run out of time, like we did with public health, we will then have them submit their questions to Madam Administrator Sue Keene, and she will send them to you so that when we have our next meeting, you will have a chance to respond. You've been through this before, so this is not you're not new to this dance, so I thank you for that. So I'm gonna jump off really quickly and ask a couple of quick questions on here. I saw that you have a lapse of 2.6 million in your personnel services account. It was reported in the 20th letter that from Secretary of OPM, and I was wondering, can you just explain what the lapse is? Is it because you have people that have left? or that are retiring, or you just have not filled all your positions?
So it's a combination of those things. It's also been our ability to try and manage overtime. So the PS dollars relate not just to salaried positions, but also hourly positions. And so that has also impacted that account and the savings that have been lapsed in that account. We may have also overachieved at some of our other efficiency efforts in terms of consolidating programs, which allowed us to be more efficient with resources in our public sector. And I don't know, Scott, if there's anything additional to add to that. We can give a better explanation at the follow-up meeting that we'll have with you all.
No, Jordan, you hit it right on the head.
Thanks, Scott.
Well, with that in mind, would you also please provide us with the number of people that might be retiring from DDS in the next couple of years? I'm sure that's going to be part of your work group. And also, we'd like to know how many COVID dollars you have received and what you utilize them for since, I'd say probably since last January. I'll say January because some people got dollars earlier than they did in March.
Scott has all the details on that for the purposes of today, because we could spend a lot of time on the details. The majority of the money that we received through COVID relief funds was spent on necessary PPE and other safety prevention measures, and the largest portion of it used to stabilize our private provider community that is dependent on an attendance-based reimbursement system and was not necessarily working the way it would have outside of a pandemic. So I believe it's been distributed in that manner, but we'll bring all the detail to the session.
Awesome. Thank you so much. Representative France.
Thank you, Madam Chair, and thank you, Commissioner, for coming here. Looking at your testimony, and it's also reflected in the budget under the caseload growth section, showing 325 high school graduates each year and others that are transitioning from other programs. Is that a typical number for budgeting as a caseload growth, or is this substantially larger than expected? And then the second part of it is just clarify you have a reduction under the individual support employment services as they're transitioning. Could you clarify that? It's not clear to me how that your transition to ISES, why you end up with a reduction in funding, those two aspects of it.
Thank you for the questions, Representative France. The first, I'll answer the second part first, and then we'll go back and answer the first part, because I'm going to need you to restate the first part. On supported employment, the articulated savings there, now I remember the first part, but we'll go through supported employment. Our anticipated savings of that account, between the administration and the legislature over the last 4 years, we've made some strategic investments into our employment work. And they're significant. And we think that we are poised now as we come out of this pandemic to really make some progress on assisting people in getting competitively employed jobs. So let me explain what some of those investments are. On the governor's behalf, the Governor's Workforce Council invited DDS to be at the table for those discussions. A lot of that work looks to do what the term they use, upskilling labor in different areas around the state. We believe that'll create a vacuum but as those people move into higher skilled jobs that a lot of the people we support will be ready and able to fill. So we're hopeful to continue in those conversations, and one of my representatives sits at that table in an ongoing fashion. The governor also and the secretary have continued to support the ID partnership funding, which is a small line item of about $1.5 million. We used some of that funding not this last year because of COVID, but in the year prior to start some entrepreneurial ventures, to do grants to help people get businesses up and off the ground, which takes people out of workshop settings or sheltered settings or group work settings and puts them into meaningful work for meaningful pay. We anticipate being able to continue to do that. FAVAR had started several years ago a project search. It's a national a national program that helps align service providers with a business entity that creates a very structured progressions for people to go into sort of an internship and then look for real work when they come out of that year-long internship program. The FAVAR's work was so successful, we started another 5 of those around the state, and they take a little while to ramp up and get your folks into, but we believe that that will allow for a number of people to move directly into competitive wage jobs and competitive employment, supportive employment. We continue our partnership with industry. We made a strategic investment in something called customized employment, along with the DD Council and others in the state, that helps providers articulate jobs that might not be perceived as ready for those we support. And the ongoing impact of the Workforce Innovation and Opportunities Act, which requires states to consider employment for anyone leaving high school and coming into adult services with an intellectual disability. When you put all those things together, we think we're really poised to make that move. The math is pretty simple. Group coverage, where someone needs constant staffing, or that's just the framework for the type of day program supports that they might traditionally get, is much less intensive once someone is successfully placed in the community, and natural supports from the employer take over what were paid supports by the state or private entity. And we believe we're ready to really push that agenda, and we think there's significant opportunity as industry has remade itself throughout the state. There's a lot of new opportunities, and there'll be more and more as we emerge from this pandemic. To your first question, which was on the issue of number of grads, it's in the ballpark of about 300 every year. I think we've seen in my tenure with the state as low as 265 and as high as 340, and it vacillates for no other reason than it does. But so I don't think that's a particularly high number, perhaps a little higher than some previous years, but not significantly higher.
Great, thank you for that. I appreciate the explanation and the helped me to understand better why the transition was resulting in I would say, a substantial reduction. And it looks like the work that has been laid out over the last several years is bearing fruit, as it were, to provide a better opportunity going forward. So thank you very much.
Thank you, sir.
Senator Austin.
Thank you very much, Madam Chair. And Commissioner, thank you very much for coming today. I have a couple of questions, keeping in line with the 2-person question. My understanding is that the state of Connecticut has moved into the private nonprofit sector, some 775 group homes, with about 30 left that are state-run group homes. And I'm curious, as we continue to move the services over to the private nonprofit, how come we're not considering keeping them whole vis-a-vis supports, financial supports? Most recently, they came to us with almost a 28% increase, but I don't see any recommendation either in your budget or the governor's budget. Did you make such a recommendation before the governor?
I'm confused about the question, Senator, and I apologize. A 28% increase in that we recommend?
The private nonprofits have asked for an increase of about 28%, $461 million. We have moved hundreds and hundreds of group homes into the private nonprofit sector as we have attempted to control costs. I don't know that we want to control costs as a result of having those workers. We continue to go after such organizations or businesses as Walmart for paying their people poverty wages, but it is the state that is the largest poverty wage sponsor by moving all of these services from the state into the private nonprofit and not paying the workers a living wage, where they are getting food stamps and heating assistance and Husky Bee and all of those things. So, you know, I think that we criticize those with one face, and on our other face are doing the exact same thing. So I'm wondering, did your budget include an increase to the private nonprofits that would ultimately take these people off of receiving state assistance in one form or another?
Thank you, Senator. So several years ago now, the legislature in the end of the Malloy administration approved and implemented for DDS only, so not all nonprofits, but for DDS related nonprofits, a minimum wage of $14.75. Upon the incoming administration and having worked now with Secretary McCaw and Governor Lamont, I have engaged in initial conversations about how that may look in future years compared to what the state's expected rise in minimum wage, because the substantial gains the service sector made during that would wash away over time, right? We would be back at the bottom if there weren't some strategic decisions about how we would do that. Given the nature of the pandemic and the economic crisis it created, the Secretary and I have deferred that conversation to get through these darker days, but it is on the Secretary's radar and something we have talked about. All of the conversions that we've done in prior years reflect that $14.75 minimum wage for direct care staff. And potentially additional dollars as well. We offered no requests for conversions of our remaining 30 homes or further privatization in this biennium budget. There's my understanding be a closure in one of our public homes. That's through consolidation, not through conversion, and that we are likely to see, while not included in the budget, further cottage consolidation at Southbury.
Thank you for that. And this is really, I just want to say I'm disappointed because this is something that I think your agency and the other agencies that count on nonprofit providers to provide the safety net for these most vulnerable people. I really would like to see us come up with a plan to start addressing this now, not in some time when it's sunny, but this is when we really need it. My second question is revolving around Southbury that you just brought up. How many clients are still housed at Southbury?
147, I believe, as of today.
And how many of them are over the age of 60?
I don't have that broken out, but I can tell you the average age as of today is around 71 and a half.
Thank you very much. Those are my two questions. I have others, but I will submit them to Madam Administrator. Thank you very much, Madam Chair.
Thank you. Senator Minor.
Okay, I'm good for the moment.
Oh, okay. Thank you. Okay, Representative Dillon.
Thank you, Madam Chair. And good morning, Commissioner. And my questions are really to ask you to bring things to the working session, so we don't need to discuss. First, I want to thank you for the work that you do. We made a lot of progress in recent years, despite the imperfections, and your department and the people you care for really took a beating this year. I know, and it hasn't been easy, but I would just like going forward to understand a lot. But first, the interaction of how people are going to get paid. And I'll just lay out kind of the fact pattern. Number one, there was hazard pay available in the spring. I believe that was ended in the summer, maybe the end of the fiscal year or the end of the July 1, maybe. The legislature and the administration, in our wisdom, have been providing some dollars for minimum wage, although I think that may create some anomalies within the reimbursement structure if you're running a nonprofit, because it might be easier just to get an aggregate amount of dollars rather than I don't know how it works in terms of who gets paid what. So if you could help us to unpack the dollars, and there are several components to it, which include Senator Austin's question and hazard pay and the minimum wage. So that's I think that's one question. But number two, we were such a progressive state, it seemed to me, when the institutions were being closed, largely because the parents sued. One of them was a former senator and said our children can thrive in the community. But if you have a community placement, you're isolated now, your day program is closed, you're not eligible for a vaccine because you're not in congregate housing, or apparently not, well, you're eligible when everybody else is served. I'm really concerned about their physical health and also very much about the effect of mental health and social isolation and regression. Could you provide us with the strategies and support that you have provided to families throughout this time and to providers so that we can meet our duty to those students in our different programs?
Yes, Representative Dillon, we'll bring to the working group all the details on our efforts, not only around day program opening, but also respite and visitation, which are all, I think, key to the constituents you're listening to. The things that we have done, the things we haven't been able to do, and the rationale as to why, and then where we think we're headed in short order. So we'll be happy to discuss further.
That's great. Thank you so much, Madam Chair.
Thank you, Madam. Representative Abercrombie.
Thank you, Madam Chair. Good afternoon, Commissioner. It's good to see you.
Good to see you.
Let me start by saying on behalf of the providers, they are very thankful for the enhanced match that you had given them in the spring into the fall of 2020. I think that your agency was the most successful when it comes to helping try to keep these providers whole, especially with day services and a lot of the work that they do that was closed due to the pandemic. I will say that I'm kind of surprised in this budget that there isn't more forward-looking opportunities for families. So where in this budget do we talk about or support children that are in institutionalized care and barriers to discharge, right? So where do we help families? I know we have the step-down facilities, which I have to tell you was an amazing program that you came up with. But where are those dollars in here?
Thank you, Representative. So let me just say a couple of things. In this last year, had there not been a pandemic, we would have looked to institute a children's step-down unit as well. It was very challenging to try and do with all of our resources being dedicated to pandemic control, but we will be using some of the money that's appropriated in our behavioral supports program to do that this year. We are hopeful that we'll be able to do that for a step-down unit for children. We have on our own been meeting as often as we can bi-weekly for some time with DCF, and I have added Demas to that conversation, following a conversation with the Office of the Child Advocate. Despite the years of working together with Commissioner Durantis in place, there is an ability for us to communicate and partner. I think she and I are so much cut from the same cloth that it makes it a really effective team. So part of that has been initially doing several things, but meeting bi-weekly and coming to use the terms that we throw around so casually to understand what they actually mean, because we use the same words differently between the three agencies. But beyond that, we've created two things. One, we're working with the hospitals across the state on a standardized escalation process for both agencies, so that they know when to reach out, who they can contact, and how will be most responsive. And then also just internally, when our staff are not able to best determine who should be the primary source for addressing the needs and identifying the resources, that there's an escalation process between the state agencies that is standardized and made accessible to our case managers and frontline workers at both agencies. So that's work that you won't find in the budget, but I think is really critical. There is funding available on both sides. It's a matter of how we use it and use it most effectively. And we do think that a step-down unit in and of itself will take some pressure off those hospitalization issues that you hear about so often. And then the fact that we have an ongoing dialogue with our sister agencies that discusses these children in crisis and these families supporting them in crisis is another helpful tool that didn't require funding, just required some dedication and some structure.
So thank you for that. And I think that the reduction in that line item for the behavioral service program, I think that those dollars should go directly to the step down. I'm actually surprised that we're making that cut when we have an opportunity to help a lot of kids that are stuck right now in our ER. So I look forward to talking about that a little bit more. What's the implications of the federal law that raised the age from 21 to 22 for our kids aging out? Is that part of the high school grad placements funding that's being increased there? Where do they fall in this budget?
So what in the budget, as I understand it, we have not changed the goalpost, so to speak, for any family who anticipated moving to adult services on July 1 and were they to want to move from school to adult day programming. That budget was left intact by the secretary. It'll be up to you to help us maintain that, but we would be able to take everyone who would be eligible on July 1 with that funding. The ability the law that would allow families to request schools to keep their children until their 22nd birthday is new. My understanding is that the Attorney General's office is reviewing that. We've had ongoing conversations with our counterparts at SDE and DCF, as well as some conversation with families and LEAs about what that will mean. If families choose, currently as I understand it, if families choose to have the child remain in school through their 22nd birthday, they would be coming late to day services, but we would not, we would be able to fund them upon their arrival. But that is not, it's not a mandate, it's not a requirement to stay till 22. And as it is relatively new and perhaps yet unsettled, we've left the money intact in the budget, or were they to opt in as early as July 1st and also eligible.
Thank you for that. I do have more questions, which I will send to our administrator, Sue Keen, for the follow-up session. So thank you very much for responding. Thank you, Madam Chair.
Thank you. Senator Abrams.
Thank you very much, Madam Chair. And thank you so much, Commissioner. I know how hard you've worked to advocate for the community that you serve throughout this pandemic, and I really appreciate your efforts. And I think that your efforts have paid off. So I thank you very much for that. I don't necessarily need answers right now. We can delve into this more because my questions are along the same lines as Representative Abercrombie. You know, since I first decided to run for office, and you know, I have a background in special education, I heard from a lot of very concerned families and groups, community groups, and people who serve the disabled community about the long lists of waiting for services, either residential or work services or community involvement services, all of those things. And so it concerns me greatly when I see us cutting back on anything when it comes to your department, because I agree with Representative Abercrombie's remarks that if there's monies to be saved someplace and to be used in a different way, then I totally understand that, because I think we do have to be forward thinking in how we use these dollars and best serve the people that are serviced in this community. So I'm very concerned about the fact that, you know, there's a closure of a public group home, and I want to make sure that those dollars are looked at to expand and that we don't have people on the waiting list. So when we work in the subgroup, I'd really like to know exactly how many people are waiting for residential services and what we're doing to meet their needs. And so why would we cut back on monies that are spent that way? And then also the same thing with the day programs and with the behavioral services programs. I just want to know, anywhere we're cutting money, why are we not reinvesting that in a different way perhaps, but keeping it in service to our disabled community in Connecticut? So we can talk about the specifics of that in the group. I won't take up the time now. Thank you.
Thank you, Senator Abrams.
Thank you. Representative Dathan.
Thank you very much, Madam Chair, and thank you very much, Commissioner, for your presentation. just a concern to me when people talk about, synergies and cost savings and things like that in DSS. I see it really affecting people's lives rather than anything else. And so what I'd like to understand is sort of some metrics of your agencies for each of the major programs that you that we're funding through DSS. How many people are being served, if we have some sort of trend on that? And I'm going to echo, the concerns of the Human Services Chair, because I do have overall concerns with that. So if you can bring those sort of metrics to the working group, so we can get a better understanding of how many people are being served, that would be fantastic. And then my second question, again, you can bring to the working group, is really getting an understanding of the transfer of the 30 people for the consolidation of the human resources function. Just really wanted to get an understanding how you feel that your agency will be successful with this transfer, if this is going to facilitate and help your agency get a better handle on employees and HR things. And I'm gonna, I have a couple other questions that I can just go ahead and send to the administrator. But thank you so much for your presentation today.
Thank you, Representative Datham. And I'll leave the details for that meeting. I think it's important to note, and those of you who've worked with me in the past know me to be pretty straightforward on things. I had concerns or a lot of input trying to safeguard what was working really well at DDS when the HR consolidation process began. And I spoke directly to Deputy Commissioner Herms at DAS that my expectation would be that we didn't lose any value in the centralization process. I recognize that there were lots of agencies that may not have had the same level of success and confidence in their HR business processes and staff as I did. And so as someone where things were running well, I was hesitant. But I can tell you now at the other side of it, Deputy Commissioner Herms has lived to his word. While it took us a little time to learn, the end effect is that it is pretty seamless to most of our staff, except for those working directly in it. And they have found their way through that transition process. And as an administrator, I was concerned I would feel a direct effect on me by that centralization. And I can assure you today that the right people are in the right places, that I don't feel any deleterious effects of that centralization on the HR side. And the reward is that the labor side has become easier for me to access. So I think in the end, it became a winning situation, but I understand why a lot of people would be concerned. So we'll be happy to walk through the details on our end at the breakout group.
That would be great, because DDS is such a, high touch organization, and it is essential that you have the right people in the right places and people that understand the nuances of your agency is much different than other agencies. And I'm just conscientious that, we need to make sure that, you're hiring the right people in your agencies and managing the right people, particularly when you have so many nonprofits that report to you, and how we're organizing all of that stuff. And I'm just going to follow on with my questions for the work group are going to be very much similar to what Representative Abercrombie and Senator Abrams talked about, because I do have, and Senator Austin talked about, because I do worry that, our frontline workers that we contract out with our nonprofits, that they are still battling COVID on the front lines. And we just need to make sure that they're receiving the adequate funding they need in the past as well as going forward, because COVID's going to be with us for a long time. And we need to be conscious that these agencies are receiving everything that they need to operate well. So thank you for your presentation, and thank you, Madam Chair, for the indulgence.
Thank you, ma'am. Senator Minor.
Thank you. I wanted to go back to the wage situation with private providers. Could you refresh my memory? How much of those wages are reimbursed by the federal government? Should we choose to put an increase in this budget?
Thank you, Senator Minor. On average, approximately 50%. And I say on average because we have some people we support who are not on the waiver who get none, and we have additional people who we support who are in an enhanced match through Money Follows the Person, where we get closer to 75 cents on the dollar. So in the law of averages, that has worked out to be right about 50 cents on the dollar, sir.
Thank you. And so for the work group, if you wouldn't mind, could you lay out a couple of scenarios that might increase the wages by 50 cents an hour in the first year and 50 cents an hour in the second year, please?
Yes, Scott will be happy to help me do that.
Thank you.
Thank you, sir. Are there Representative McGee?
Thank you, Madam. My question is fairly simple, and we're still with DDS. Excuse me for not knowing correct. Just toggling between 3 different meetings. So nonprofit providers have come to the legislature asking for pretty much a 28% increase over the next 5 years. Why wasn't that increase included in the DDS budget?
So I think there's 2 important things to note about your question, Rep. McGee. One is that the Alliance in making that ask represents nonprofits beyond DDS nonprofits. So that number would in total would attribute out to multiple nonprofit agencies. In particular, DDS got a little ahead of the curve, in our opinion, with the 1475 minimum wage bill that the legislature passed a few years ago. I think it's also important to note that the secretary is looking at a number of budget models that don't show us being in a space where an additional enhancement at this time would be proper with the spending caps and the spending authority that she has. Having said that, I certainly hear from the nonprofits that and understand, I ran a nonprofit. I was one of those agencies that the lower funding impacts their ability to recruit, retrain, provide benefits, and to pay people an appropriate wage for very meaningful and important work. So I do understand the ask of the Alliance on behalf of all nonprofits, in addition to the DDS nonprofits. So I don't have a better answer than that for you at this time.
Okay, I guess for the sake of time, Madam Chair, do we have 2 questions or just 1? Sorry, I'm coming back home, so I need to know the rules again. Okay, so my second question would be, the state received substantial coronavirus relief fund dollars, and continues to receive a significant FMAP bump for our Medicaid services. Can you explain how those funds were passed on to the nonprofit providers?
So we will bring all that to the working group and provide you that in writing, how our current CRF expenditures were made and to whom. We have all the detail on that. It's an important reminder for everyone on the call that unlike Representative Abercrombie gave us some shout outs, and I've learned to just say thank you when she gives compliments, or she tells me I need to learn to say thank you. So thank you, Representative Abercrombie. But it should also be known that we are positioned in a slightly different way than our sister agencies in the way that we bill Medicaid. So many of the other Medicaid Medicaid agencies bill directly through Medicaid. So the FMAP is in the reimbursement, the enhanced matching program. We go through a process called certified public expenditures. The result is we were able to do some things with a portion of state money and federal money that allowed us to respond quicker and to put the money out there a little faster, and then use the CRF funds to restructure it when they were made available. It makes it a little more complex. It allowed DDS, our antiquated billing process that isn't direct Medicaid, did allow us some flexibilities my sister agencies didn't enjoy or have the privilege to deploy. So, but we'll bring all that detail, Rep. McGee, to the special session.
Thank you, sir.
Thank you.
Thank you. Representative McCarty.
Yes, thank you, Madam Chair, and welcome, Commissioner, and thank you for your testimony. Just very quickly, I noticed you talked about in one section that you found supportive housing for 21 individuals working in Canton with the Bear Apartments, and I found that very interesting, and that it looks like you did some partnerships, like in a public-private partnership. And would you be able to break out for us, so we have more information at the working group, just how much federal funding and private funding and how that actually operated? And then looking forward, I think it's exciting, and I'd just like to learn a little bit more about that initiative. And then on the behavioral services program, I noticed that was cut, and I think it was, you mentioned due to attrition, but I am worried, as Representative Abercrombie has mentioned, throughout all of the mental health needs that we're going to be confronting going forward. And I just want to assure that that is appropriate in that cut there. And if you could maybe give us a little more detail there, but I would like to commend your department for all of the work during this very challenging time. So I appreciate everything, and I just think it's great that we have some new initiatives going forward.
Thank you, Representative McCarty. We'll bring the detail on the behavioral supports program to the special session. I did want to take the opportunity, as you raised the program run by FAVAR up in Canton. Several years ago, there was urging from OPM and the governor then to include in our appropriation something that was referred to as IDASH housing. This is the first big opportunity for us to talk about that strategic investment multiple years ago. We anticipate that there'll be additional projects coming online, and we think that it is a mechanism by which we can serve more people with less dollars, but without any degradation in quality, and perhaps provide a richer community experience and a better integrated community experience for those who can live in those types of settings. So we're really, really excited. I can't thank the folks at DOH who partnered with us from the beginning of this, as well as our budget staff at OPM, who have known this as an opportunity. When that IDASH came about, autism was housed here. We've also been able to facilitate opportunities in future developments to include individuals with autism no longer part of our service system that would be included in those housing opportunities, and that's a really terrific opportunity as well. We'll bring more detail on both of the subjects you asked us to speak to the breakout session. And you thanked me for the work of the agency, and I appreciate that, and you are welcome. None of what we've done in the last year would be possible without our direct work staff, both in public and private. And you've been talking about them from whether it's the public side and downsizing or the private side and wages. We have done incredibly well as an agency and as an industry. And it's entirely on the backs of those frontline workers who carry the weight, who've shown up every day despite the risks and despite the concerns that they may have had. So it's reflected in my testimony. I wanted to make sure I said it for the video portion as well, to thank all of them. So thank you for the opportunity to mention that, Representative.
Thank you. Thank you.
Thank you. Thank you, sir. Are there any more questions from any of the members of the committee? No. Well, we got finished in 50 minutes, which is amazing. Thank you, Commissioner, and I look forward to seeing you in the working group. And if anybody can remember any questions, please send them to Madam Administrator so that she can submit them to the agency. Thank you. Thank you, sir. Have a good afternoon.
Thank you. You too. Pleasure to see you all.
Thank you. So that concludes the morning session of Public Health Subcommittee. We will reconvene at 1 o'clock. So everybody enjoy their. Thank you.